Inside Pediatrics contains real-life surgical scenes in a hospital environment. Viewer discretion is advised. On this episode of Inside Pediatrics.
If we had not intervened, within 6 months to a year, Dalton would not have been alive.
I just don't want anything to happen to him.
When we woke her up a little bit, we increased the voltage inside their brain.
In the middle of America lies one of the busiest independent non-profit children's hospitals in the country. Go inside the operating rooms and the transports. Go inside each family's journey, each patient's story. I'm coming home. Go inside Pediatrics at Children's Mercy, Kansas City.
You can use it on the seat up here if you want.
No, fire truck. You stay there, bye.
7-year-old Kendall hopes this doctor's visit will be different from all the others.
It's okay, but remember we have to pick him up when Dr. Avers comes in.
Kendall's parents have been taking her to specialists for 2 years, trying to find out why her arms twitch. The spasms make it hard for her to do simple things, like stacking blocks or writing.
When she's writing, it twitches. That makes her feel very abnormal. I think she's had like 10 or 11 could be, might be, possibly diagnoses. And the frustration of being a nurse and being a mom and not being able to fix my child is very hard.
Pediatric neurologist Dr. Brian Albers is determined to find the answer.
How you doing?
Hi.
Guy, I like your outfit. It looks really awesome.
Dr. Albers sent Kendall's DNA to the Children's Mercy Center for Pediatric Genomic Medicine to identify her mysterious condition.
So we got the test results back, which was consistent with DYT11, or myoclonus dystonia.
She has DYT11.
Yeah. DYT11 is a form of dystonia that also presents with sudden jerking of the muscles. Eventually, her brain will not be able to coordinate the muscles, and she'll form permanent deformities in her limbs and arms. I know it's never good to have a disease, but...
But we have an answer for the very first time. It's bittersweet, but we're actually here with an answer, you know, so...
Patients that I've seen with this do extremely well with deep brain stimulation.
In deep brain stimulation, the neurology team places permanent electrodes inside Kendall's brain. Electric impulses will then regulate her brain activity, like a pacemaker for the brain.
What is the risk of this type of procedure causing a stroke?
I can't say it won't happen. It is a complicated surgery. We have to do it awake. We have to do it with many specialists and many team members. And Children's Mercy is one of the few places in the country that allows us to do that.
As it being a surgery, we're going to go home, and there'll be a lot of discussion, a lot of questions drawn up.
We have a lot of faith in Dr. Avers and definitely Children's Mercy. We have a lot of pressure relieved off of us, knowing that they're going to be the ones taking care of her from this point on.
5-month-old Kaysen's shoulder nerves are damaged, so he can't bend or lift his right arm.
Okay, let's get your arm up there. Are you going somewhere? Well, come on. Let's sit up there for a while.
Physical therapy has helped, but nerve specialist Dr. Christine Cheng will evaluate Kaysen to see if surgery could restore more movement.
So, how are you, Kaysen? What we know is about 1/3 of the babies, they'll recover up to a certain point and then not improve beyond that.
Your big thing is the elbow, and the shoulder's made some improvements, but not enough to be able to just leave alone.
Okay. So without the surgery, there's a chance that Kaysen won't improve any further than he has now.
Dr. Cheng wants to schedule surgery quickly to give Kaysen his best chance.
I just don't want anything to happen to him, so, you know, I'm a little nervous about it, so.
The Children's Mercy medical staff serves children all across the region. This team is packing for an outreach road trip.
Our coolers are what we've got so much stuff of.
The team is bringing life-saving blood products and specialized care to children with hemophilia, hours away from Kansas City.
the Hemophilia Treatment Center. We cover from West Kansas to mid-Missouri, north to Nebraska, down to Arkansas, Oklahoma. It's a big, big geographical area.
This trip is to Dodge City, Kansas, about 5 hours away from Kansas City.
What we're trying to do on a day-to-day basis is help families live a normal or close to normal life. The scariest thing for a lot of families that are out here is the feeling that they're dealing with their bleeding disorder alone. So we have these nice discussion questions. Anybody want to take a stab at this one? How would you describe hemophilia?
Group meetings help create a sense of community for families who may feel isolated by the disease.
Children with hemophilia don't bleed faster, so it's not like you're going to get a paper cut and bleed all over the place. It's that people with bleeding disorders bleed longer. So as long as we get the bleeding stopped, the healing process will happen.
After the education component, families look forward to Clinic Day tomorrow. Moberly, Missouri is almost 3 hours from Children's Mercy, Kansas City. That 3-hour drive was the turning point for a desperate mom and her dying son.
Hey, Dalton, let's get our shoes on.
3-year-old Dalton was slowly losing his health and his hearing, and no one knew why.
At 1.5 years, I noticed he was gasping a lot and waking up screaming. Within 6 months, he can't hear no more, he can't talk no more, he falls all the time.
Kara took Dalton to every doctor she could. None of their diagnoses seemed to help.
They just kept on saying, oh, it's behavioral, it's behavioral. And I was like, no, something's not right. I told my kids, we're gonna lose him. It was very hard to tell them that. Their 3-year-old brother was gonna die.
In desperation, Kara drove Dalton to Children's Mercy, Kansas City, hoping someone there could save her son.
A Monday night, I loaded him up in the car after the kids went to bed at my aunt's house, drove to Kansas City. I said, I just want some kind of answer to why my son is deteriorating before my eyes.
Dalton arrived at the emergency room unable to walk and struggling to breathe. Doctors called the neurology team to help diagnose his life-threatening condition.
Dalton was literally falling apart in front of our eyes. I mean, if we had not intervened, I'm quite confident that within 6 months to a year, Dalton would not have been alive anymore.
Kayson's 6-hour nerve graft surgery is underway.
So for the first part of Kayson's surgery, we're going to take the nerve graft out of his leg.
The team must locate, identify, and reconstruct nerves that are about the size of a spaghetti strand.
Now we're in a position to start finding the nerves, and we're going to start seeing all the nerves and vessels in Kayson's arm.
Dr. Cheng will determine which shoulder nerves are not functioning and rebuild them.
The sensation nerves we will not be needing to reconstruct. So these are 2 of the nerves that allow for finger bending. As expected, appear pretty healthy. Now we're going to look for the nerve that bends the elbow. That one is having a problem in Kayson's case. If this nerve were functioning, then we should see his elbow bend.
After isolating the damaged nerves, Dr. Cheng maps out her reconstruction plan.
So we've got 5, 6 are okay here, and then rupture here.
Right.
And then an avulsion at C7.
It takes 2 hours to place the microscopic sutures.
So the nature of the nerve surgery is do the reconstruction and then allow the nerves to grow to see what function he gets back.
Okay. But he did fine. He didn't have any problems, okay? So you can relax now. You can actually breathe.
I can't wait to see the progress. Actually gives me hope that he'll be able to do a lot of things that I want him to do.
I think we've always been ready to do whatever we had to do. So this is just the same thing. We're going to put in as much effort as before the surgery, after the surgery. We're going to give him the help that he needs to get this arm going.
Dalton was literally falling apart in front of our eyes. We did what we do at Children's Mercy, which is we brought the whole team together. And one of our docs there recognized the disorder and said, I wonder if this could be Brown-Violletto von Leray syndrome.
BVVL can be life-threatening, and quick action is Dalton's only chance. Dr. Lepichon prescribes vitamin B2, or riboflavin, a promising new treatment which may help if Dalton does have BVVL. Meanwhile, doctors at the Center for Pediatric Genomic Medicine try to confirm the diagnosis by analyzing Dalton's genetic code.
When we're dealing with children presenting features of a diagnosis that's so rare, so unusual, most physicians, even well-educated subspecialists, haven't heard of it yet. And so genome sequencing can be a very powerful tool when trying to find answers for patients like that.
Scientists analyzed the 6.4 billion nucleotides, or letters, in Dalton's genetic alphabet to confirm the diagnosis.
What we were able to see rather quickly is that he had two variants that had been seen before in Brown-Violletto van Leer syndrome.
After several months of B2 treatment, Dalton is back at Children's Mercy for a checkup.
Alrighty, so Dalton, tell me, how are you doing, kiddo?
Say we're doing okay.
Dalton had an almost immediate response, and he has since been very, very slowly regaining some skills. You want to come and take a look at this? Good job, yay! So this is actually a clear improvement compared to November. He has completely stabilized with this treatment that has essentially no side effects.
He don't let anything stop him, that's for sure.
This is the perfect example of a team coming together to solve an extraordinarily rare disorder with a treatment that has stopped the disease.
Although the diagnosis at Children's Mercy saved his life, Dalton's hearing may have been lost.
He's getting his cochlear implant?
Yes, June 2nd.
June 2nd.
The implant will help Dalton communicate better as he lives with this rare disorder.
Way to go, Dalton.
Just before her head is shaved for brain surgery, Kendall shows everyone her new purple hair.
I love it. It is cute. When you're interacting with the kids, you make it fun and you make the most of it.
Well, you're going to do a new haircut today.
It's like your nurse, but a friend or a new buddy at the same time.
All right, so when we get in there, you let us know if you have any questions or concerns, okay? It's all about you, okay? Can I get a hug?
Here we go.
We're going to take really good care of her.
Deep brain stimulation resets irregular brain patterns. The neurology team will place tiny electrodes deep in Kendall's brain. They will stay there for the rest of her life.
We get a high-resolution image of her brain, and we can look how to put the electrode into the brain without hitting any blood vessels into the exact right spot.
We're kind of coming in pretty vertical on that.
The area we're trying to hit is about the size of a pea, so a lot of it was spending time making sure we're getting to the right part of that brain.
All right, Kendall. Let's get a little pressure. Oh, awesome. Good job.
Doctors screw tracking markers into Kendall's skull so the computer can guide them when they're placing the electrodes. Even though she is heavily sedated, Kendall must remain awake during surgery so Dr. Albers can monitor the effects of the deep brain stimulation.
Okay.
With computer-guided precision, the neurology team prepares to insert electrodes into Kendall's brain.
So the brain is like the consistency of cold toothpaste. It's really kind of this gooey, kind of electric pulsating mass. You put the electrode into the brain like a straw into a bowl of Jell-O. You can sort of, if you push slowly, you can sort of push it down into the area of the Jell-O. We use the targeting system to make sure that we find the right spot.
There's an electrode now about a centimeter or ½ inch above where our target is. Then we'll slowly just drop that down at 1 millimeter at a time, looking for specific recordings on the brain. We want to find kind of a characteristic pattern that let us know we're in the right spot. We're 2 below target now.
So we're just bringing up ½ millimeter?
The only way to test the electrode placement is to have Kendall raise her arm and see if it still twitches. The pediatric anesthesiologist carefully reduces her sedation.
Kendall, it's Dr. Albers. He's here to talk to you.
Hey, sweetheart, you doing okay? You open your eyes for me a little bit? There you go.
Yeah, just open your eyes. Good
job. When we woke her up a little bit, we increased the voltage inside their brain. And when we lifted her arm up, it stopped the myoclonus.
Hi. You're doing awesome.
Good job. No myoclonus at 3. No myoclonus. It's awesome. We're disrupting the rhythms that are causing the abnormal movements. She's having an instant response to it. It's a very encouraging sign that we're in the right spot, and this is going to be a very effective therapy. We had her hold up her arm, and we turned on the electricity, and the myoclonus stopped, which was pretty amazing. Wow. It worked, and which we're very excited about. She's doing great. We put her back to sleep. It's just amazing to be in a situation where we were able to make a difference that quickly. This is the reason you become a pediatric neurologist.
That's all I've asked for. That's all she wants. So that reassures us we're doing the right thing.
It's morning in Dodge City, and doctors begin seeing the first of their 18 hemophilia patients and their families.
She poked him once, I poked him once, and both times that we poked him, it didn't work.
You did the right thing, I think, just, trying again and then calling us.
Dr. Wicklund started this in 1989. He was doing outreach before outreach was cool, kind of leading the charge on that.
When I got here in 1988, we found very quickly that we needed to get out to other places in order to engage these patients. And the reception from the patients from the very beginning was they liked it. It became a cornerstone of our operation.
What are you doing, Miss Kay?
I'm mixing your factor.
During the clinic visits, every aspect of these hemophilia patients' care is monitored and adjusted to optimize their day-to-day health.
What do you want me to do?
Well, what I want to do is I want to find out how you're doing on your new factor.
Dr. Carpenter follows outreach patients year-round and looks forward to checking in on their progress.
I see you're seeing well, aren't you? Do you see this?
Yes.
You do. That's awesome.
He's come a long way, but at one point we weren't even sure he'd be able to see. Actually, we weren't even sure he'd be alive, so...
Alive.
Alive.
We are grateful.
Outreach clinics will always be a part of what we do. They'll always be there because there are populations we need to serve that can't get to us. We have to go to them.
Surgery rebuilt Kayson's nerve pathways. Now his parents and occupational therapy focus on strength and control.
Not you moving your arm. Did you do that?
Even though it looks like play, these exercises are vital to Kayson's development.
Pre-surgery, he really just started to do a little shoulder shrugging. He didn't have anything past his shoulders. So it's nice to see at this point we're getting a little bit more movement. Now we're just looking for it to come back a little bit more. And then, of course, we want to see him bending his elbow.
Yeah, I'm ready for you. Show me your muscles.
It's really amazing to see that he's doing so much that he wasn't even doing before the surgery.
Oh, good. I saw that arm moving some more.
We're just excited to see from here what else is going to happen. I'm hoping very soon crawling because he can already push up on his knees. So I'm hoping that he can push up on that arm and get going. If not, Mom's pushing for walking.
Progressing very nicely.
Today, the surgical team implants Dalton's hearing aid.
He used to talk, he used to hear, so start of communication again, a new beginning. All right, here, hey. Yeah, that's
This is Dalton Johnston. He's here for a left cochlear implant.
A cochlear implant is a device that is placed through this bone behind the ear so that we don't have to go through the eardrum. Just kind of developing this little pocket behind the ear where the implant will sit. Goes in under the flap like this. So that's what the implant looks like underneath the skin. So you can see there's a little bit of a bulge where the internal device sits from about there to there. It'll become less and less noticeable as he ages. All right, that's it.
Dalton's recovery from BVVL syndrome could be reported in medical journals around the world.
Hey, baby.
But his mom's hope is for simpler things.
He's going to be able to talk again, and I'm going to get to hear I love you, Mommy.
A few weeks after surgery, Dr. Albers checks Kendall's progress.
Remember where you were 2 weeks ago?
Yeah.
All right, I want to show you some pictures. So this is you on the day of the surgery, okay? Being able to provide this technology to children as young as Kendall means they can have a childhood again.
Much better.
In 3 or 4 months, there's a very good chance she'll have a 90% reduction in her myoclonus with the jerking.
We're very excited, very excited. This will be a lifelong treatment, but every day we see progress. If it wasn't for Dr. Albers, I don't know where we'd be at this point.
You're doing great, Kendall. You're going to get much better, all right?
On the next journey inside Pediatrics.
A 5-year-old little boy was involved in a motor vehicle crash. All right, can you hold really still? The car rolled over and he may have been ejected out of it.
We have to be careful. There's still a vein that connects to the heart.
Anyone on a heart transplant list is sick and fragile.
She was scared she wasn't going to wake up.